Hi, my name is KBritton and I'm going to be discussing part 2 of the case study for SPCE638. Here is a brief overview of client description and background. This client is a 4-year-old male with autism spectrum disorder diagnosis. He received this diagnosis from his pediatrician when he was a little over 2 years old. He has been with the ABA company since he was diagnosed, the same one. The client uses some full words and vocal approximations to communicate. The behavior of concern is elopement. It is operationally defined as taking 2 or more steps away from adult after hearing "come here" or "stop," or leaving room or designated area without permission. Examples include running away from adult after instructed "do this" or say "ah." Non-examples include running in hallway and playing chase, or running onto the crash mat. Prior to the intervention, the problem behavior caused the client to constantly receive attention from therapists. Chase is one of the client's preferred activities. He also likes attention in other forms such as tickles and being picked up and held. When the client engaged in elopement, whether there was presentation of task or not, he gained access to chase or some kind of physical attention. The therapist had to prevent the client from running away by putting hands on him, or if the therapist was not fast enough, he gained access to playing chase. The client instantly received access to chase or other physical attention without requesting appropriately for it. So the client constantly received attention for elopement. The problem behavior was reinforced every time the client ran away from therapist. The intervention we chose to go with was functional communication training. Since the client has limited vocal ability, however improving significantly, we accepted approximations as well so that he could meet the contingencies more frequently. We differentially reinforced better approximations. If the client engaged in elopement to escape a task, we prompted the client to use FCT to request a break appropriately. We prompted the vocal "go." We allowed a 1-minute access to a break from task. After 1 minute, the task was represented for client to follow through. If the client engaged in elopement to gain access to items or activities, we prompted the client to appropriately request access to the item or activity. For example, if the client wanted to play chase, we prompted the vocal "chase." If the client wanted to transition to a different room, we prompted the vocal "go." If the client wanted to play with a ball, then we prompted the vocal "ball," and so on. FCT can address both escape maintained and access maintained functions of elopement. FCT teaches an appropriate replacement for elopement by teaching an alternative communication skill to request a break or access preferred. Regarding evidence-based nature, research by Boyle and Adamson in 2017 provided evidence that FCT can be used to teach a communicative response that is functionally equivalent to elopement. In the next slides, I will discuss integration with BACB task list items. H1, state intervention goals in observable and measurable terms. Intervention goals added to the behavior plan were written in observable and measurable terms. Short-term goal 1, the client will request to go when provided with a full verbal prompt with 100% accuracy across 3 consecutive sessions. 2, the client will request to go when provided with a partial verbal prompt with 100% accuracy across 3 consecutive sessions. Long-term goal, the client will request to go independently with 100% accuracy across 10 consecutive sessions. Identify potential interventions based on assessment results and the best available scientific evidence. FBA results showed that the function of the client's elopement was to escape tasks, basic human interaction, and to access tangibles. FCT served to teach appropriate replacements for these functions. FCT can be used to teach communicative response that is functionally equivalent to elopement. H3, recommend intervention goals and strategies based on such factors as client preferences, supporting environments, risks, constraints, and social validity. Goals were created to align with clients' preferences and communication abilities. We use preference assessments throughout the course of the intervention to determine the client's preferences. Elopement is a safety concern. FCT allows for an appropriate and safe replacement to elopement. We have not yet been in home with the client, but that is a future goal with this intervention. As parent reports, elopement occurs at home. H4, when a target behavior is to be decreased, select an acceptable alternative behavior to be established or increased. Target behavior is decreased. Target behavior to be decreased, elopement. Acceptable alternative behavior, FCT. FCT teaches appropriate communication skills as an alternative to elopement. Desired behavior communication is increased through reinforcement of alternative behavior while placing undesired behavior, elopement, on extinction. H6, monitor client progress and treatment integrity. Data was collected on client progress during each session. Client progress was monitored through visual analysis of graphs. Through visual analysis of the graphs, we were able to determine whether progress was being made or if changes needed to be made due to lack of progress. E2, determine when consent and assent should be gained with the client. The behavior plan was emailed to the client's parents. We did not begin intervention until we received sign-off from parents. And here are my references.